Hi there, it's Sherry Busby. I'm a respiratory therapy student from Parkland College. I'm here because the doctors ordered for you a pharyngeal airway. Have you had that before? Okay. So, first thing I want to do with my patients is you're going to assess the vitals, go listen to the breath sounds, the respiratory rate, make sure that the patient looks okay, they're not cyanotic. And what I also want to do is before you even start with the nasopharyngeal airway, the oropharyngeal airway, is you're going to check the patient wristband. Since they're conscious, because we're doing the nasopharyngeal airway, you're going to be like, okay, can you see your patient wristband real quick? Can you repeat your name and date of birth for me real quick? Okay, thank you very much. All right, once you get that out of the way, you're going to go ahead and start. So, what I'm starting with is the nasopharyngeal airway. What this is going to be used for is usually just establishing an airway, and more than that, it's so that we can get a method for us to get a suction catheter in there, being able to clear any screening. So hey, we noticed you've had a lot of secretions, so we're going to get a suction nasopharyngeal airway in there, and it's going to help us suction some of that out. So when measuring this, you're going to do from the tip of the nose to the apice of the ear. So it's lower part of the ear. Okay. Meatus. All right. So make sure always bevel is facing towards the inside of the nose. And once you put it in, just going to slowly slide it in. Okay. Make sure it's all the way in there. It's nice in there. So that's how that looks when that's set up. Okay. Make sure that it's adjusted. Make sure it's not like sticking out like that. Make sure it's nice and flush. And that's how you set up the nasopharyngeal airway. Okay. Next part. All right. So now we're going to say we've done that. They've been suctioning a few days. Now we come back. The patient's unresponsive. They're unconscious. They're trying to bag them. They can't get a stable airway. So what we're going to do is we're going to put in a oropharyngeal airway. How you're going to do that is you're going to open the mouth and measuring it, of course. You're going to make sure from the matches up with that and goes to about back of the jaw. Gonna tilt this in like this. You're gonna sweep it past the tongue. Make sure your tongue doesn't get stuck in there. Push it in, and twist it around, and then it should fit like that.
Okay. Is there any other concerns that you have with the placement of the tongue?
So you don't want to you're gonna make sure the tongue is put down. You don't want to push it back into the back of the throat because that's gonna do the opposite of what putting this airway in is, which is get you a stable airway so you can bag the patient and ventilate him correctly. So that's one of the issues. Another issue you have to address, which I address when saying my patient's unconscious, is with a oropharyngeal airway, if they have a gag reflex and they're awake, they're going to use that gag reflex and you're going to get some esophageal stuff you don't want. It's going to vomit on you. Okay? So that's how you set this up. After you're done with that, of course, you want to reassess patient vitals, respiratory rate, heart rate, pulse, since they're probably bagging the patient, SpO2, and that's how you set all this up.